Welcome back to Inside Guelph. It's time for your city update. So joining us is Mayor Farbridge. We'll be talking about the Community Wellbeing Initiative. Thanks for being here. Good to see you.
Good to see you too.
How is the initiative going?
Really well. We've just come out of an extensive period of consultation, and I know that we've talked about it over that period of time, different opportunities for members of the public to either be part of a survey or go to a focus group or some session. So we've gathered all that information, and now we're moving into the action plan stage, working with people. And so if anyone's interested, we've got design teams that are meeting over the next couple of weeks. They can register online at www.guelphwellbeing.ca.
Okay.
And there's 8 teams. I've brought them with me because I always manage to forget one. Time use, leisure and culture, community vitality, living standards, healthy population, environment, education, and democratic engagement.
So what would the teams be doing for someone who wants to sign up? What can they expect?
Well, they will be provided with all the input that we received, so the themes that really resonated with people under these areas, and then some of the goals and some of the ideas that generated out of our consultations. And so they will take that and then start discussing, well, how do we move, where's the interest or priorities, and how might we move that forward? Mm-hmm. And who takes the lead on that? And this is a community thing, so it's not just about City Hall, but it's about collectively where can some of these things be implemented. Mm-hmm. And so to give you an example, there's been some really interesting discussions around healthy populations and community vitality, which are actually linked, and a lot of the domains have some overlaps in them. So we learned a really interesting statistic, or I certainly did, that of healthcare dollars that come into our community, and this is the same across the province, about 70 to 75% of all healthcare dollars goes to 5% of the population.
Whoa. And
so in Guelph, that's 5,000 people. So the conversation is, like if you have a financial lens, you would say, well, you're going to focus on that 75% of dollars that's going to the 5,000 people. But from a people lens, from a patient-centered lens, you'd say, well, can we be doing something differently to provide some better health outcomes for those people so they don't have to call on the system as much, and then you free up some funding. And so there's been a really interesting conversation in the community with the family health team and others talking around that. And then it links into community vitality, which is also around safety. So the chief of police is very interested in how these things link up, because the same risk factors that lead to crime and victimization are the same risk factors associated, whether it's addiction or mental health or drug abuse or poverty and a whole bunch of other issues, which we have a number of organizations in the community that provide services to try to address.
So it's all linked, obviously.
Absolutely.
So he has a very invested interest.
So the chief and the deputy chief and I went to a workshop in Waterloo where they showcased a model that's been very successful in Saskatchewan, and it was really piloted out of Prince Albert. And it came because crime was escalating, which is not escalating in our community, to be clear, but costs were going up, and definitely costs are going up here in terms of policing. Mm-hmm. And so they looked at that it wasn't going to be sustainable, so how do they do things differently? And so they brought people together, shared data, analyzed that data, found out where the risks were in the community, had a much more coordinated response, so had broken down the silos between mental health services, public health, policing, and were able to achieve cost reductions, savings, but better outcomes for people.
And I mean, when you say it like that, it sounds like common sense that we wouldn't have done this before. So I'm glad this is happening. It's our time to stop complaining and actually do something about it and get involved. So there's more information on that website, and of course, you're always a good fountain of information if people have more questions. Thank you so much for being here. Taking a short break. When we get back, it's your business community update. I'll see you back here in a minute.